Welcome to the Honest Health Podcast with your host, Jeffrey Burke. Honest Health brings you the brightest minds in the natural products industry, as well as athletes and entertainers. Jeff will keep you entertained and informed while educating on how to be successful on your healthy journeys. Now, here's your host, Jeffrey Burke.
Hello and welcome back to the Honest Health Podcast. Jeffrey Burke here. I am so glad you're here today. Another awesome interview coming your way. Dr. Todd Born is with us today, naturopathic physician, certified nutrition specialist. So much good information going to be coming your way, and you're going to like it. And when you read the bio, you'll get all the great information about him and his wonderful journey. But today we're going to be talking about some of the things that I think are really important, and I think they're important to all of us. And that has to do with the possible changing face of the natural products industry, because we're all going through a metamorphosis, and hopefully the changing face of the medical community as well. So help me welcome my guest. Hello, Dr. Born.
All right. Thanks, Dr. Burke. I appreciate you inviting me.
I am so glad to have you here today. Your reputation precedes you, and that's always a good thing, especially when it precedes you in a wonderful way.
Right.
So thanks for taking time to be here today.
Yeah, again, this is great. I'm glad we could sync up.
Interesting thing, being in the industry as long as we have, we've seen a lot of changes, and, changes happen quickly and sometimes overnight. Other things we want to change a lot faster, and they've been dragging their feet for decades now. If you had to say the best thing that you've seen come out of the natural products industry in maybe the last decade, what would it be?
It's a really good question. So yeah, I've been involved in the industry in one aspect of another on the business formulation kind of side of things, not just a consumer, since I was a student rep at medical school back in 2008 to 2010. So, I mean, back then, right, there was not even direct to consumer e-commerce kind of things. But I would certainly say just even in the last 10 years, the quality of the raw materials, the ingredients, the paying attention to what goes in there, even most people, right, don't know the difference between like zinc oxide and zinc colonate and its bioavailability and things of that nature. I mean, you and I do, right, because we're on that side of the formulation side of things. So I think that's been able to improve people's care. Companies are becoming more socially responsible, more ethical, and actually following GMP, right? There's this big misnomer in the dietary supplement space that it's the wild, wild west and it's totally unregulated, which you and I both know is not true. It's highly regulated. It's poorly enforced. And that's just the way it is because the FDA only has so many field agents. So now more and more companies are having people like you and me that have medical training and putting together formulas that are actually going to be efficacious and they're going to be safe. And that ultimately improves, overall people's health.
And to your point, I think that that's really, really true. And I think that the average person out there, they either don't have the time or they don't have the want to really do the deep dive into the clarity of supplements and minerals and individual nutrients. Like to your point, zinc. All zincs are the same to most people. Zinc is zinc is zinc. And we saw this during the pandemic when they were talking about people taking zinc as a preventive and all those wonderful things for our immune system. And people were buying anything that said zinc on it. It didn't matter what it said after the zinc, but I'm seeing that the knowledge factor, the education aspect of our industry is changing. What has happened negatively, being an educator for 4.5 decades now in our industry, over the last 5 to 10 years, we've seen a huge buy-up of businesses from people outside of our industry. Now, they brought a lot of money in, they brought a lot of stuff. Is that good? Yeah, I guess it is. Are they ever going to have the passion that we have? I doubt it. I mean, because we're passionate people, they're business people, all said and done. But I think what has happened is a lot of these companies came in, and I think they deleted the most important part of the companies that they purchased, which is the education departments. Because if you were so interested in these businesses that you purchased, you would realize that the reps and the brokers and the formulators and the sales teams and the education and all that stuff is what created this beautiful kind of utopia that you wanted to purchase. So you purchase it, but then you start using the guillotine and chopping off all the things that got that business to where it is.
That's right.
So that being said, I think a lot more people are really starting to search out the information and the education and, kind of siding up with companies that have education on board, and they're reading more and they're listening to podcasts more because they're trying to find answers because it's not coming to them in the same stream that it did before. So they're looking to naturopathic physicians. They're looking to people they can have a conversation with about alternatives and other choices that they can look at. They don't want to fall into the one size fits all pharmaceutical needs. Pharmaceutical drugs have their place, absolutely, but so do other things. And I think that, you're doing what you're doing. It's so much more desirable to the average person because we want the conversation, but we also want the people that have the knowledge and the passion.
That's right. Yeah, I completely agree with you. I mean, it's across industries, and I think it was a year or two ago. I think it might have been Forbes. I saw it on LinkedIn. It was an interesting story where they were talking about just regardless of the industry, worldwide, private equity and venture capital essentially buying up everything. I've even seen this quite a bit on Medscape, where private equity comes in and they buy up hospital systems or large outpatient care systems. And what's that actually doing? Sometimes these are really helpful. Yeah, I would say with an influx of cash, and they can really up the game. But generally speaking, in my experience with the dietary supplement industry, that most of the time, like you said, they're looking at profits, right? They look at the P&Ls and they're like, okay, how can we squeeze more money out of this? So let's get cheaper raw materials that are typically inferior quality. Let's hire someone who doesn't have that high pedigree because they cost less to now take over, do formulations and education, but they don't have that same level of training, knowing that it's going to be a flip, right? That's what you do when you buy companies as a venture capital or a private equity firm, is that you will exit, and because your investors want their money. There are some good firms out there. They do a lot of good work. There's also a lot of not so great ones, and I've seen the damage that it's done. And one example is a great example. I think like the poster child is Pharmaca. So this beautiful integrative medicine pharmacy that was, they had, I think, 50 locations in the Western United States. And it was a conventional pharmacy, so they had pharmacists. They also had supplements, they had health, they had naturopathic doctors on staff, where that way you could come here and really be like this bastion of integrative medicine. Private equity took them over. They bought into an industry that they had no idea how to run or manage or experience in. And within a few years, they filed bankruptcy and they closed all 50 stores, and, thousands of people all lost their jobs.
It's a shame. It's dreadful, and I mean, I understand the financial taunting. Don't get me wrong, because we're talking big money for a lot of these companies. And I mean, that is a life-changing event for the person that's been working 40 hours a day for the past 20 years to get their companies to where they are now. I get it. I don't judge. I think it's great. I think it's harmful because I know that with almost, not to stereotype, but almost every one of those buys, there are going to be a lot of people that get cut. The fat gets cut.
Right.
And I just find that very disheartening because all of those little levels that are there together all added up to where they are today. They're not the same without it. And then when you start, to your point, cutting down the quality and the integrity of the raw products and other things as well, the company changes. It's not the same anymore. Or they start changing tablet sizes in the bottle. They go from 100 to an 80 or a 90, and people don't really look at it, but that adds up. Huge profit for the company. So I guess I'm very supportive of private business. I think, do what you're going to do, but do it with due diligence, do it with a conscience, and do
Yeah,
it with a purpose,
that's right.
and don't be hurtful.
Yeah, I couldn't agree more. And you'll see, and also you'll get inferior quality products. So I've had even my own patients that I prescribe, I use more than 25 brands in my practice. And, and I work and I consult for a lot of dietary supplement companies, from, medical affairs, scientific affairs, regulatory affairs, formulations, the whole thing. And then I'll have a patient be like, this isn't working. I've been on this for years. And then I'm like, and the formula may not even have changed, but I know for a fact, because I may have someone who still works at that company, or I may have consulted with that company, that they went to an inferior ingredient because it's cheaper, and that's why it's not working. And that's another reason why I think the dietary supplement industry gets a lot of, negative publicity, is that, well, this doesn't work, that doesn't work. Well, if you actually buy a formula that's therapeutically dosed, doesn't have a bunch of pixie dust in there, you're like 1 milligram of that, and you're like, that's not going to do anything, and higher quality, and it's dosed correctly, that'll blow people's minds. They're like, oh my God, I can't believe how much this thing works. This is amazing. It's like, yeah, because now I switched you to something that works.
And it's so very true. And the thing is, it's so hard for someone to cross over that bridge from totally living in a pharmaceutical pharmacy-based mentality to finally open their mental doors and their heart to say, okay, I'm going into a health food store. I'm going to go see a naturopath. I'm going to start something a little bit differently. And they go in and they're all in for the win. And they go in and they buy some of these inferior products. They get no results. So they're like, I knew it didn't work. Rather
Yeah.
than going in and talking and finding something different or stronger or something that may fit them better, they don't do that. They're just like, it doesn't work. And then we lose them.
Yes,
And
exactly.
that's
And then
so
you'll see negative
disheartening.
studies. And you see negative studies too, and you actually look at it and you're like, well, there's a reason that there's no overall decrease in mortality. There was no all improvements in this. And you actually look at the formula and you're like, well, that's why, because you're using these low bioavailable ingredients, or it was underdosed for another one I'll see. Oh, substance X didn't improve any outcomes here. It's like, well, yeah, look how much you were using. That's not enough to do anything. That's a preventative dose, not a treatment dose. So it is what it is, and you and I just have to kind of navigate that and do the best we can.
But you know what happens on the pharmaceutical side? And I have friends, and these are some of the smartest people I know, but when it comes to medicine, they are just, Lord. They'll take antibiotics. They'll take a full dose of antibiotics, and they need it, so they're using it. So they'll do
Mm,
the full dosage for like 3 days. And they start feeling a little bit temporarily better. And they're like, okay, I feel better. I'm going to save the rest of these for the next time. And then 2 days later, they relapse and they're twice as worse as they were before. And I'm like, look,
right.
if you have to do it, then follow the protocol. If you're going to go to the trouble of doing it, do it the right way. But then their mentality goes to supplements. Well, it's 4 a day, but I'm just going to take one because one is better than nothing. Why don't I feel anything? So they make it frustrating, but people are people. So I try to stress, I said, if you do the full serving size and you're on it for a period of time and you want to cut back, that's the time to play with the dosage. Cut back. You know what it feels like. You know how you're reacting. Cut it back a little bit and listen to your body. If your body's reacting the same way as it did at the full serving size, then maybe you can run on less, but don't take like nothing and never even get the benefit of what the product was meant to be.
That's right.
So
Expect to do something. I get these rheumatoid arthritis patients, for example, and then I'm like, what's worked, what's not worked? And they'll be like, oh yeah, my rheumatologist told me to take turmeric, and I didn't really notice anything. So my questions are always the same: was how much turmeric? How many times a day did you take it? What was the brand? What was the form of turmeric? And then we kind of go there, and they're like, oh, I just kind of got something on Amazon, and I don't know, it was like 250 milligrams, and I took like one a day, and I was like, that's why it didn't work. And then I'll switch them to a higher quality, higher bioavailability, give them really, especially because they have active disease, rheumatic disease, really high loading dose, maybe 2,000, 3,000 milligrams of divided doses. And all of a sudden they're like, this is crazy. I could taper off my NSAIDs. And then, like you said, listen to your body, and they go to a lower dose. That's why it's working, because it's better. It took more of it that actually makes it work. They don't, it's particularly botanicals, right? They don't work like drugs, which is a weakness, but the strength of them is that they work on multi-mechanisms, right? Multimodal actions, lower side effect profile. So they can work in some instances, in many instances, better than medications or enhance medications efficacy. And I'm not anti-medication either. I prescribe them
no.
all the time to patients.
Mm-hmm.
Time and place for everything. But I'm like, I can get you off your methotrexate, we can get you off your NSAIDs, or at least now to just, if you have a flare, you take a little bit, because you need more. That 250 milligrams you grabbed off of Amazon, which could be some joke brand that doesn't even actually have turmeric in there, because Amazon's quality is smoke and mirrors mostly. You don't know what you're gonna get. It's buyer beware, and the FDA investigates them all the time. But Amazon has a lot of money to stall things, and they're trying to improve their program, but it still isn't where it should be, just from a safety standpoint, let alone efficacy standpoint.
I was doing a lecture recently, a consumer lecture, and one of the questions came up and she goes, I have a question for you. And I said, sure, shoot. And she says, my husband takes turmeric for his shoulders and it makes a difference. And I take it for my knees and it does make a difference. How does it know where to go? And I went, okay. I said, when you have a headache, what do you do? She goes, I take a Tylenol. And I said, okay. I said, do you tell the Tylenol where to go? She goes, what do you mean? I said, you hold it up and say, I need you to work on my headache, and then swallow it. And she goes, well, no, that'd be ridiculous. And I went, and
Yeah,
she went, oh.
I get it. You're right.
And I thought to myself, there's some wild mentalities out there. There really is. God love them.
Yeah, yeah. Even when I speak at medical conferences, I'll speak a lot of integrative and functional and naturopathic medicine conferences, but I'll get asked to speak at say a like the token kind of functional medicine person at a conventional, so I know who my crowd is. It's gonna be tough. There are usually some naysayers, and they'll be like, "Well, you don't know." I usually get this all the time. Well, you don't know how your medicines work. I was like, "You don't know how we don't know how your medicines work." For example, you tell me how aspirin fully works. Most drugs, when you look it up at the mechanism of action, it'll either say mechanism of action unknown, full mechanism of action unknown, postulated, theoretical. Yes, we do know a fair amount, like it will know. But for example, tell me how when someone has, primary progressive multiple sclerosis and they take the drug Tesfidera, which upregulates NRF2, how that helps them with multiple sclerosis. Yes, it's anti-inflammatory because it's an inflammatory condition, but it'll even say mechanism of action. So don't hand me that, we don't know. We do know. It's just that there is that kind of divide, unfortunately, where, it's moving in the right direction where there's a time and place for everything. There's an enhancement, like where you can have someone who takes a natural agent with a medication so the medication works better, so they can be on a lower dose, have less side effect profile. But it is an interesting world that we kind of live in the United States, where anything that's not a drug is snake oil or placebo, or it's inferior in every way.
I was on a panel, a couple of years ago, and I was on with two MDs, and one you could see had his foot dabbling in the naturopathic side of things, and the other one was just married to the pharmacy. And then myself, and somebody asked him what the percentage of his patients that benefited from pharmaceutical medicine. He says, I usually run probably 20-25% of them really benefit from the medicine. And he kept defending and defending and defending it. And he looked over at me and he said, well, what's your percentage? I say, people that are, depending on what they're using. I mean, we can't measure the benefit of a multiple vitamin. We can see down the road what they're doing. I said, but we can see a lot of benefit of things that we're doing. I'd say a much higher percentage. And he goes, what with drugs? And I said, why are you trying so hard to defend something with such a slow success rate? I said, don't get me wrong. Pharmacy drugs have a place. I have friends that are alive because of pharmaceutical drugs. And I said, I've used them. I had an infection 3 years ago. I would have been dead without those antibiotics that they gave me on. I had sepsis. I had everything. It was terrible. I would have been dead. So do I give it its kudos? Absolutely. But why are you fighting so hard to defend something with a closed mind to something that actually may have a higher success rate? And it was just crickets. And I didn't want that. I wanted a conversation, but it just shut down from that point. And then about a month later, he reached out to me and he goes, I get it.
Yeah.
And I said, you do? And he goes, I do. So we met at the next conference and had dinner, and it was a great conversation. He said, I don't know why my eyes were so closed. I said, it doesn't matter. I said, you're more aware now, and that's great. You're going to be a better doctor for it.
Right. Well, that's interesting because, particularly when you get into certain stages of practice, you become, say, more dogmatic. At the beginning, you're like, I'm this way. And then like year 5, you get humbled because you make mistakes and things happen. And then it's like more open. And then you get to maybe like the 15-year mark and it's like, I'm not learning anything new. I'm not changing the way I do it. This is it. Right. Because, doctors, generally, we go through a lot of school, a lot of training. We don't want to learn new things. We want to go with the old standard. Yeah. It's like, that's what works. It's tried and true. You're like, but there's especially medicine, right? It advances quite quickly. So that's great that he was willing to change his mind, because many times, right, they don't care. They're like, nope, it doesn't work.
Well, I closed my mouth after that conversation. I was like, oh my God, there's like 1,000 people in the audience, and I just laid it out. And I was just like, well, this is going to go one way or the other. It's either going to go good or really, really bad.
Well, that's years of experience. That's years of experience that helped you.
I guess so. And mild gift of gab.
Yeah.
So let's go to the next stage, medicine. Medicine has changed a lot. I told you a story about, way back in the late 80s or early 80s, how doctors used to come to the health food store to the back door to pick up their orders because they didn't want their colleagues to see them in a health food store. So we've come from that to now doctors that carry lines of products, or they get their own name put on a line of products in their office, or they write handwritten prescriptions for the health food stores now. What's going on with this now? Where are we?
Yeah, that's a good question. So, like even the doctors in my family, right, who are all very conventionally trained. One of them, he's a family practice doc. He's retired now. But when I was trying to find where I wanted to go in medicine, I was going to go to conventional medical school. He and I were talking. he actually took a 500-hour, this is probably what, in the late 80s, early 90s, a 500-hour homeopathy course. And he was in a large family practice. And there were him and two other colleagues. They literally had to see patients after hours to do homeopathy and other naturopathic integrative medicine, because if the conventionally trained physicians in the practice caught wind of this, they all would have been fired. He was like, literally, it was like, behind closed doors, someone brings your child in for ADHD and we're doing homeopathic intakes and had to be all secretive. And it was just me and a couple colleagues because everybody else was like, this was basically witchcraft. And I think it depends where you are. I have colleagues at Kaiser Permanente, say in California, and these are pain specialists that they are not allowed to recommend anything, say natural. So they'll, like you said about the piece of paper, I have a colleague, she's an anesthesiologist and a pain specialist. She was practicing out of our office when we had a physical practice in California. She was there a day a week because her passion was functional medicine, but conventional medicine was paying the bills. She said that on sticky notes, she would tell people to help with so they didn't have to take so many opioids, take this much turmeric, this much fish oil. She's like, because I was not allowed to put it in their chart or I would get in trouble. I was like, that's just like medical malfeasance. She's like, that's their system. And this wasn't that long ago, right? I mean, this is, not even 10 years ago she was telling me this. But I think generally, the system of medicine is becoming more integrative, where there's a time and place for everything, and there is a place for both. Certainly most conventional medical schools, they do have electives in functional medicine, integrative medicine, but they're not mandatory. They're still, even DO schools, right? There's very few DO schools that are really traditional DO schools. I think there's 2 left now, but they're still all conventionally trained. But I have most of my good friends and colleagues are medical doctors, and they're either still very conventional or they're interested in functional medicine, or maybe they have some training and they became like an integrative psychiatrist but they still tell me that no, for the most part, it's still a pretty big divide where, conventional medicine is the only thing that works and everything else is snake oil. Everything else is going to poison you. It's all a waste of money. And you're doing medical negligence because you're telling someone that they can benefit from X, Y, and Z. But generally speaking, and what I've seen in medicine, even the last, say, 5-6 years, and I've been in practice, this is my 16th year, is that generally speaking, it's not that conventionally trained physicians are interested or accepting of, say, functional medicine, naturopathic medicine, is that they're forced by patient demand. Patients want to know more. They don't want you to have a 7-minute visit and then just be like not even talking, doing your charting, and then you're writing the script. It's like, whoa. Why do I have this? Are there other options? Or I'm not tolerating this medication, or I failed this medication, or I'm in breakthrough pain. Now I've got all this polypharmacy. So they're demanding it, which is driving a lot of, I think, this the functional medicine naturopathic space more so than acceptance. And now they're kind of forced to do it, or they just send them to me because they're like, I don't know anything about naturopathic medicine or functional medicine, so go see him because he'll do his due diligence and not lead you astray. But yeah, it kind of goes like this. It kind of ebbs and flows, and I think the next wave, it's going to be flowing more into integrative medicine. There's a time and place for both.
And I don't blame some of the doctors. Some of the doctors have become part of big conglomerates where it's like they walk in and you turn over a 3-minute egg timer, to your point, and I try to train everybody I have to write their questions down ahead of time, because when you get in there, most people get white coat syndrome and they forget to ask questions. And if you leave that room, those questions are not getting answered until you make another appointment.
Yeah.
And I feel bad for them. So, I always flip out my doctors when I go. They don't like it when I come, because when they come in, I have a little 3-minute egg timer. So they walk in and I turn it over. And usually when they're putting on rubber gloves, I'm putting a pair on along with them. And they're like, what are you doing? And I said, I'm trying to break the concentration for a minute so I can get to the real you.
Yeah.
And then they kind of let their guard down and we have a great conversation. But I mean, I get it. They've got a certain amount they've got to see. It's like a factory.
It's like, a total factory.
They've got to fit them all in, and they don't really get to do the medicine I really think they want to do.
Yep.
And I think the only way to do that today is to go out on your own and find a place where you can go out on your own and know that there's going to be some ramen days and years until those practices build up. I get it. But I am happy to see that there are people out there that at least are getting more of a mindset. That's promising.
Yep. And I see a lot of even conventionally trained doctors because burnout's so high, because exactly you're saying, you're seeing 25, 30 people a day. They don't want to practice this way, but they have to. And the executives who are running these large outpatient clinics, hospitals are buying up all these places. Even where I live in the Puget Sound area, I mean, there's just a handful of hospital systems, and they're buying up everybody, right? They're all buying. The University of Washington buys up these people. Virginia Mason buys up all these people, and now you got the appointments are shorter. You got to see more in a day. So what I'm seeing more is these clinicians. What they're doing is that's what pays the bills 3 days a week, and then 2 days a week now they're trying to go out on their own and they're doing functional medicine because they love it. They're like, this is great. I got 30 minutes, 60 minutes. I can really do some good versus just keeping. And even my colleagues say this all the time. They're like, basically the way we're trained in conventional medicine for the most part, I guess it's Hippocratic oath, tolle cause and all that. You keep that person alive until the next visit. That's really all you have time for is medication management, triaging. And as you and I both know, the conventional medical model in the industrialized world, particularly in the way that the United States is set up because it's so insurance driven, you're not paid for time, you're paid for procedures, is that it's very deft and skilled at urgent and emergent care, acute care. It's not well equipped to handle chronic disease, of which most people have, because you either die from that acute illness, that's just biology 101, right? You've got bacterial pneumonia, you've got sepsis, or you survive. Most people have chronic disease. Conventional medicine is not well equipped. So what do you do when you see your internist or your family practice doc? It's like, oh, that's your gut, go to gastro. That's your thyroid, you go to endo. Oh, that's a knee sprain, I can handle that. Oh, that's a cough, I'll handle that. But it's just this, this compartmentalization, and you just send everybody out versus people like how you and I are trained, which is more like, yeah, we can handle all of that, still using specialists for their clinical prowess, medication managements that are outside of my skill, scope, and training. And that's how you get those people better. It's not well equipped for people who have, autoimmune diseases where they're just like, okay, here's your meds. And if you fail all those meds, you considered a failed, patient. I have nothing left for you. Just stay on prednisone the rest of your life and take NSAIDs, and hopefully you don't have a heart attack and blow a hole in your stomach.
And I think people get locked into a routine. My mother passed away in January, and I was in the emergency room with her about 2 years. Thank you. She had a great life. I was in the emergency room with her. Now, if you go to the emergency room, there's curtains. There's no walls. There's curtains in between. You hear everything.
That's your privacy.
Yeah. So I'm sitting with her, and she's looking at me because it's really loud. And she's like, Jeffrey, just be calm. She's making me be calm because I'm freaking out. So next to me in the curtained area next to us, the nurses are like freaking out. They can't get the guy's blood pressure to go down. They're getting bag after bag after bag after bag of potassium, giving him all this potassium. The blood pressure is not coming down. They're doing everything they can. So the doctor comes in, and I hear him say, what's the matter, nurse? And she goes, we're having trouble getting his blood pressure down. He goes, give him some potassium. She goes, we've given him like 4 bags of potassium. All he's doing is urinating a lot like this. And I'm sitting over, my mother's looking at me going, this is not going to go well. So finally I just opened my mouth. I said, for the love of God, please give him some magnesium, will you? And I was like, oh, that was my outside voice. And so I went to my mom. The doctor opens up the curtain, and he looks at me, and I'm like, and he closed the curtain. He goes, give him a bag of magnesium. So they're giving him magnesium. 15 minutes later, the blood pressure had plummeted down. And the doctor walked over, and he opened up the curtain, and he goes, thanks. And I said, like this. And he goes, you forget. He goes, I forget about magnesium. I'm so busy putting in saline and potassium in everybody's dehydrated arm that comes in here. He goes, I forgot. He goes, I will not forget again. And I went, I'm so sorry. He goes, don't be. He goes, my mother's going, I knew this was going to happen. So.
Well, it's good. And it is amazing. Even in my own practice, like I've been practicing a long time, and then sometimes, like I just had a patient the other week that I saw for a lot of things, and then it was afterwards, some of the initial things, it was allergies. He had a bunch of things, but allergies was on there. And then like 2 days later, I was like, I can't believe I didn't give him my allergy proof your life handout. I didn't give him some like literally basics. I went like right to the middle tier of things. And I was like, it's like 2 days later, I was like, oh, and he's been a patient of mine forever. So I emailed him over the weekend, and I was like, hey, sorry, I had just like literally basics that would have very immediate relief, because it would take him time to get the supplements, these things, so he could sleep at night. not have so much apnea. His tonsils are all swollen. But you're right. It is easy, especially once you get practice a long time. It's almost getting like too comfortable, and you shouldn't be maybe concerned enough at certain scenarios. And then the basics, the common sense things just can fly out the window. And it needs a double check. So it was a good thing you were there, right? It was kismet.
I look back and I was visiting my mom on another visit the time before she passed, and I was there and she brought this up. That's why it's fresh in my mind. And she said, "Did you feel bad about that?" And I'm like, "No." And she says, I said, "Did you feel bad?" And she goes, "No." She goes, "I just knew it was coming. I could tell." And I said, we get busy, to your point. I said, we get locked in, we get busy, we wear blinders sometimes. We're just trying to get results to move on to the next, because it's literally like an assembly line in a triage emergency room. I said, they were trying to get that immediate situation of bringing the blood pressure down. And they were doing what we usually do for 9 out of 10 people. And I said, no, I don't have any. I said, I don't have any regrets. I said, if I stick my foot in my mouth, I'll just rotate feet, So that's kind of who I am.
They didn't have to take your advice. They didn't have to do anything. You were just there. And hospitals, I rotated in my residency through 2 emergency departments. One was level 1 trauma, level 3. They're very algorithm. I mean, there were people coming in. I remember with this one ER doc. I mean, the attending physician. This guy he's a machine. He's like the guy you want in your corner. And he's also very into naturopathic medicine. What I was surprised at this hospital is a private pay level 3 trauma unit in Kirkland. So the hospitalists didn't really care for me. They would see my tag. It says naturopathic physician. They would ignore me. The nurses mostly ignore me, but the ER physicians, almost all of them, which again was surprising. They love NDs, which I did not expect that kind of reception. And so I kind of was talking, they're like, you're the kind of doctors that keep people out of the emergency department. You know how many repeat people we see in here? And they a lot of times would ask like people coming in with chronic headaches, right? Chronic migraines. They're always coming in for pain meds. They're like, what would you do? But I remember there were a couple stroke patients came in, and there's this algorithm right there where they all dictate that has the flow, and you cannot deviate from that flow. And algorithms are very helpful, right, in emergency situations. And I was like, well, what if this person isn't following the algorithm? He's like, well, then you are technically using your own clinical judgments that's outside the hospital guidelines, and you can get in trouble. And I said, have you ever been called? And, because these people who run hospitals, right, they're all, like you said earlier, they're all business types. Rarely do they have medical training. They all have, MHAs, right, Masters of Health Administration, and they're looking at what they're supposed to do, right, really the finances of the system, but not necessarily the finances and the health and well-being of the patients and the employees, et cetera. And he said, yeah, I've been called in before, and I've had to defend myself internally to the board of why I made this adjudication, this medical decision with this patient, who was stabbed or whatever, who was having a stroke, because they did fall outside the hospital's algorithm. I was like, well, who sets the algorithms? He's like, it's usually a team that reviews evidence that then has these guidelines, and they establish internal protocols and algorithms inside the hospital. I was like, oh, that'd be so hard, difficult. He's like, it can be very challenging because I come from another hospital where we do something, our algorithms are different. Yeah, there's certain standards of care, but each hospital has their own protocols, their own algorithms, how they do things, and they're set internally, and you have to follow them as a clinician, or you're outside their scope.
Is it kind of like a Cliff Note version?
Yeah,
like bullets. Like this is it.
It was a flow chart. They had all these doctors. Like there's a station, right, where they're all the emergency rooms. You've seen the hospitals, right? So they have that nurses station in a circle. This particular hospital, when I was at Harborview, which is a level 1 trauma, and it's community, that place is just chaos because it's a level 1 trauma unit for the entire Pacific Northwest. So even like, say, people who have major trauma from Alaska, they're getting air vac'd into Seattle for this. So that was a little more chaotic, but still by where they would dictate, there's all these charts, these pieces of paper that are pinned up, even on cork boards, and they're just algorithms, and they have flow charts, and then in the side arrows will be like, person has this, you give them this. If they don't, it's just all algorithms.
Wow.
And I was like, this is crazy.
I guess I've seen those, and it didn't register as much with me, but I'm having flashbacks now.
Yeah, it was like Yeah, it was
Oh,
they were like stroke ones there were heart attack ones there were like gunshot wounds for and they just had the flow. And most of them, those, they've been doing this so long, they have them memorized, but there were times where they would have to they'd be like they'd follow their like the EMT usually they're like they would come over the PA system and they're like someone's getting air vac in, they have this and this, and then the ER physicians would be getting and the nurses would be getting a room prepped, and then that physician might be sitting at their desk and they're like looking through the little algorithm, and I'm like, wow, that's probably handy. But then I asked him later because he was rushed. I said, as he and I were talking later when things calmed down, I was like, what happens if they fall outside that algorithm? He's like, yeah, then we have to do our own judgments, and and that's if we don't. It's like hopefully they survive, which they usually do, right? Because we stabilize them. But if we don't, he's like, you get called in front of you get basically called up to the office, and then you get talked to, and you have to defend your decisions why you didn't follow the protocols and the algorithms. Um, and I said, "Do you ever get reprimanded?" He's like, "No, I mean, it is what it is, but yeah, they don't like it, especially if you come from a hospital where it was an old way, and then now you're learning the new way of those protocols." I was like, wow, and that's just medicine, right? It's very protocol driven, and even our medicine, right? This holistic medicine is now trying to be. Everybody wants a protocol. What's your protocol for SIBO? What's your protocol for, hyperlipidemia? What's your protocol for chronic fatigue? Well, everybody's different. I mean, there's some base things you do, right? The base of the pyramid, but you're getting away from personalized lifestyle medicine, personalized medicine, to fine tune it for that individual because they might need something. They're more than likely need something different. So yeah, I have my protocols after 16 years of practice, but they're definitely no two people are alike, no people's
yeah.
conditions alike, so no two treatment plans are alike.
But there are people out there that'll say, well, it's like dieting. I'm going to go on a diet for the period of time it takes me to lose some weight, and then that's it. It's like a very quick and done. And they want the same thing with like supplementation. They want to take it for a little while to make everything better, and then they're done. And they do the same thing with pharmaceutical drugs. People don't want to do things long term, not realizing that both pharmaceutical medicines, if prescribed correctly, can be life changing and life sustaining, as
Right.
well as supplementation. Can change your life completely. But you got to do your part. I mean, I've had people that have told me, well, is there a way to do this without having to count calories or, this kind of stuff? And I said, look, you got to eat healthy food, dude. You got to get some rest at night. You got to be active. You got to drink water. You got to manage your stress. I said, you got to find a way to decompress. That's on you.
That's
That's
right.
your stuff. I can help you with the other stuff, but you got to do this. I can't hold your hand. And
Oh,
if you
Americans
want,
love shortcuts.
I know.
That's one reason. Look at GLP-1s. That's one reason why they're so successful, right? People are like, this is great. I could shoot myself up. I could still eat my McDonald's and I'm going to lose weight. But look what happens when you stop the medication and you're not adopting a healthy lifestyle and the sleep and the stress and everything you just mentioned. Americans love shortcuts. Yeah, we'd love to not have to do anything, right? Even my practice in California, preponderance of patients would rather have come in and just have IV therapies all day and we would talk to, would you like to, let's talk about changing this and changing that and some supplements, some of this, some of that. And so they're like, no, they would drop I'm not kidding. They would drop $10,000 on a set of IV packages rather than actually address root cause.
Yeah, give it to me.
They love, yeah. We're like, okay, I mean, it's your dime, but we also are here to like cure you and heal you. So for example, I remember this lady, she had chronic migraines and she was referred to us from a headache clinic. And she said, the only thing that's ever worked are magnesium pushes. And we said, okay, how long does that last? She's like, oh, I could be headache free for like a day, or a week, depending. She failed, all therapy. She was refractory to these. And I said, and so it was another doctor in our clinic, in our practice. My wife and I own the practice. And I'm really good with headaches. So I called in. I said, well, we can actually more than likely cure you of your headaches. All the scary stuff has been ruled out, aneurysms, tumors. She said, yeah. I was like, so would you like us to go with the most common causes or, food sensitivities, structural, which was already assessed, and we could do homeopathy and we got 99.9% cure rate. And she said, no, just the magnesium pushes. So she came in every week, 5 years, and got magnesium pushes at $125 a piece or whatever it was. She didn't want to go, and that's okay. It's her call. But I'm like, and every now and then, the whole stages of change, the pre-contemplation, I'm like, you sure? It's really easy. We just give you an allergy elimination. I can even do IgG food testing on you so you don't have to go through the 2 weeks of the allergy elimination diet, knowing that there's, there are some drawbacks of the IgG testing. She was starting to get irritated sometimes. She's like, no, just the magnesium push. Okay.
And and there are people like that. We can shake our head all we want. But the thing is that this is what drives them. And I'm like, I turned to one of those when I was growing up. They used to have the cars with the back window with a little ledge in the back, and they would have those little dogs laying there, and the dogs would just do this. That's what I do most of the time now. I just go, okay,
yeah, exactly.
Shaking my head. So I really have enjoyed this. Will you come back and see me again?
Anytime.
I love having this. This was wonderful. So I got a question for you. My question is, if you could make one change to the medical establishment, the whole medical field, and it'd be your number one wish that would bring about change, what would that one thing be?
Well, that's quite the wish.
I know.
Yeah, you told me offline, you're like, I got this great mystery question for you, but I'm not telling you what it is. No. So no, I like that. If I had like a magic wand, that I could wave, and because so 70% of my practice is US, 30% is international. I thought our system was broken, but now seeing people in all these other countries, their system is just as broken, just in different ways. But because ours is so insurance driven, that if I had a magic wand, I would say that the insurance structure was different, where it wasn't all about just profits, right? You never hear about an insurance company going bankrupt. With the denials and everything, is that they covered everything better. So lower premiums to patients, better reimbursement to doctors. Doctors could spend more time, and there was better coverage for this functional naturopathic, integrative medicine, the functional testing, because that in my practice is where I see a lot of hesitation and resistance, which makes sense, right? Because it can start costing a lot of money, right? Is that there should be better pay and better insurance coverage for all the things we want to do. They'll cover 100% for your annual wellness. Why won't they pay for any of these other preventative interventions or treatments? You'd rather wait for them to be a full-blown diabetic, than actually treat them while they have better when they have metabolic syndrome, or they're kind of creeping up to pre-diabetes, et cetera. So I think that if I had a magic wand, there would be better coverage and doctors could spend more time. So then insurance game wasn't a game.
I love it. No, that's fine. You and I are a lot of the same wavelength here. I hope you guys have enjoyed this today. I've had so much fun. My guest today, Dr. Todd Born. Make sure you download this when it comes down. Go to my webpage, drjeffreyburke.com. You can tap on the logo. It'll take you to all the platforms if you want to listen to audio while you're at the gym, on the treadmill, or driving around. I would love for you to go to my YouTube channel and watch the interview. Get both the audio and the visual. I think the conversation and the audio-visual combination, I think we take more away from things that way. We're using two different parts of our brain. I think it's important. While you're there, remember to push the subscribe button. Subscribing does a lot. What it mainly does is it gets the light. I get more plays. I get more focus on my guests. I want them to be seen more. I want the light shining on all they're doing, because I think it's really, really important in today's world for the people that are making changes and helping to change the world, that they get their due. So, Todd, thank you for being here today. What a great pleasure. And I hope that we'll chat soon. I know our paths will definitely cross.
Thanks, Jeffrey. I appreciate it.
Have a great day.
All right. You too.
Stay tuned for more information from the Honest Health Podcast with Jeffrey Burke. And make sure to check back often for interviews and conversations from the guests we all want to hear from. I'm John the Announcer. Thanks for listening.